My name is Arshia Carr, and today I'm going to explain to you MRSA and why this disease is so important. First, I need to talk to you about what Staphylococcus aureus is. Staph aureus is a bacteria that can cause infections in humans. You can see it on the right under a microscope. It's normally present on humans in their skin, nose, and gut, but it can cause infections when it goes to places it's not supposed to be. Usually it presents as a skin infection, as you can see on the bottom right, usually as like red inflamed boils, but it can also infect the blood, bones, and organs to cause much, much worse diseases, and they can even be fatal. The main treatment for Staph aureus is antibiotics. So now you're probably thinking, you just told me you were going to talk about MRSA, and that's true. But there's one more concept I need to explain before I can tell you what MRSA is. Antibiotic resistance. I'll use this graphic to help me explain. Antibiotic resistance occurs when we use antibiotics repeatedly and incorrectly to treat bacteria. Eventually, an antibiotic-resistant bacteria can mutate, and when we use the antibiotics, it can wipe out all of the bacteria except this antibiotic-resistant one. This antibiotic-resistant bacteria is then able to duplicate and become the only bacteria around in that area. This makes treating future infections of this bacteria much, much more difficult because the antibiotic-resistant one is the only one left. This leads me to MRSA. MRSA stands for methicillin-resistant Staph aureus. This strain of Staph aureus occurred because people get regular infections of Staph aureus, and methicillin, the antibiotic, was used incorrectly or too much to treat those infections. This resulted in strains of Staph aureus that eventually mutated and became resistant to methicillin. These strains, now called MRSA, are extremely difficult to treat as they're very resistant to to antibiotics. So why is MRSA so important? 60 to 65% of Staph aureus cases in hospitals are MRSA. Over 278,000 cases of MRSA were found in the US in a 7-year period, and 5,500 deaths annually are related to MRSA. On the right, I've included a little figure made by the UK Department of Health, as these track the number of deaths related to Staph aureus. And in the dark blue, you can see the MRSA strains that are causing death. As you can be able to tell, the resistant strains are much, much more of a threat and can cause more deaths than the regular strains of Staph aureus. So how do people get MRSA? MRSA infection occurs when MRSA can enter your openings in your skin and in your wounds. It can be transmitted throughout the community, person to person, when you have close contact with somebody who has a strain of MRSA. So if you shake hands with somebody, you could be at risk. The main culprit, however, are healthcare and hospital settings. These places have a lot of people who are already sick, which makes them more susceptible to these infections. Typically, the healthcare workers have been implicated just because sometimes, they're traveling between patient to patient, which means that they can bring the bacteria with them. So how do we solve this MRSA problem? Well, the first step is to tackle MRSA in a healthcare setting. So hospitals are enacting a lot of different procedures to make sure that healthcare workers are not bringing infectious bacteria with them when they go between patients. So that includes hand washing, making sure that gloves and masks and protective clothing are being used properly, that everyone is immunized, etc. We're also using different drugs to treat these MRSA infections once people get them, like vancomycin or daptomycin. However, it's important to note that these drugs are extremely strong, which means that they can have detrimental effects on patients, it can really harm them. So sometimes if a patient is too ill, they can't even take vancomycin or daptomycin because it would just make them worse. So unfortunately, we need to think about alternative drugs or alternatives to antibiotics to help treat patients who actually get MRSA. Thank you so much. I hope you learned a lot.